So A is basically available. Whenever any US FDA investigators come to the site, okay, whenever any of the US FDA investigator come to the site, they come only to check cis-PQA. And what is the meaning of availability? Availability means whether you will be able to produce the product consistently throughout the period of the contract or whatever the approval period that they were given, whether you will be able to make sure that the drug is available in the market, whether you are capable of that or not. So whenever they will come for the audit, they will check this part. And if you are not capable of making sure that your processes, your equipment, your let's say people, your environment, your entire let's say setup, if that is not capable of generating the producing or let's say producing the drugs consistently and giving the availability in the market, they will also not give you the US FDA approval. Yeah, mind blown. This is the new term
So,
which has come. Yeah.
so means availability means product availability in market.
Yes. Yes.
That's the only, or anything else,
No, no,
any
that's the
additional
only thing.
things.
Availability means the availability of the product in the market. So you are consistently producing the products, making sure that your processes, your people, your systems, all your things in a manage in a such a way that you are not going out of the production. You are consistently giving, because for them, patient serving is the top priority from the cis-PQ perspective and also from the availability perspective. Let's say there is a patient in the US and they need your drugs, and if it is not available in the market because of whatever the reason at your end, maybe equipment is not working, maybe supply chain is disrupted, or whatever the reason is there. If you are not able to make the product available to the market, then they will also consider as one of the point in assessing you. Yeah. Clear?
But
Yeah.
sometime there are means hundreds of product, and due to any kind of reason or market requirement, there is no market requirement. Particular organization is producing some means best selling product or which is required in market. So continuously, it is possible that we are not producing any means some kind of product continuously for 6 months, 1 year. It is happening. Then in case what happen?
So, Pushpak, this is for the products which are in high demand. Let's say there is a demand in the market and you are not able to supply. If there is no
Okay.
demand and you are not supplying, that's okay. That's not a problem.
Mm-hmm.
You are, let's say take a example of a cyanocobalamin. There is a really in a shortage. That drug is shortage in the US, and you are one of the supplier. And now there is some problem at your end, and you are not able to supply that part, though you are approved or you are able to sell to the US, but because of your internal reasons, XYZ reason, you are not able to supply, which is in high demand, and they want that drug. They want that drug for the US patients. And if you are not able to supply, they will see this as a serious
Yes,
step.
getting sir.
Can you repeat, Pushpa?
No, no, sir. I'm getting.
Yeah.
What you
Okay.
are saying, I understand.
Yeah. So it is not for all the drugs. It is for the drugs which are required in the market, required by the USF, let's say US patients, and you are not supplying. So availability is a new term which is being coined by the US FDA. So now it is not only about the cis-PQ, it is also about the cis-PQA. Yeah. So that's the
Hmm.
term. Now I hope now everyone understand that why cGMP is the most important thing, or why we need to follow all the regulations in pharma, because any patient who is taking the drug, and if there is something wrong in the drug, maybe your strength is not correct, your identity is not correct, maybe you have to put, let's say 650 mg, but you have put only 300 mg. So maybe the patient will get a less dose, it will not cure. If let's say the patient is required for a particular, let's say high BP or the blood pressure medicine, it requires only 10 mg, but it has been given 20 mg. Then heart attack may happen. That person can collapse. So that's the main point, that why we are more regulated, more, let's say, controlled, because this is directly going to the patient. And of course, if it is, let's say, injectable, then you can't do anything. If any of the vial goes badly, and then the patient has gone, because it directly goes into the vein. Yeah, clear, everyone?